Welcome to Daytime Ottawa here on Rogers TV. A special edition for you today as we are dedicating this entire show to COVID-19, the pandemic, and how it's affecting our community. We were supposed to be joined this morning by Dr. Andrew Wilmore. Unfortunately, he was not available for us today, but we are very fortunate to have Dr. Ken Farion joining us on the show. He's a medical director of strategy, quality, and systems improvement at CHEO. Dr. Farion, thank you so much for joining us today. Really appreciate it.
No problem, Derek.
Dr. Farion, let's jump right in and talk about best practices. You know, we've been hearing a lot of information. Unfortunately, this day and age, and sometimes fortunately this day and age, we get a lot of information on social media, but we get a lot of misinformation. So what are the best practices that the healthcare system, that Ottawa Health is recommending?
So most importantly is to start with, if you are sick, please keep yourself distanced from others, wash your hands, and in public space, then please wear a mask so that your secretions, your coughing and sneezing is contained. That will help limit the spread. If you happen to need to be out in the world because you're on your way to healthcare or need to be out with other people, that you're wearing a mask, that you're practicing good hand hygiene. If you are well, then it's new age of maintain social distancing and most people remaining at home for most of their day, then please do that. Please do not be out in public, gathering with others if it's not essential to what's needed to happen. So if you're not an essential worker, then please try to work from home or stay at home as you're directed to. The worst thing that can happen is that those that are healthy are out and about unnecessarily and coming in contact with this, and then increasing the burden on the healthcare system as they're getting sick unnecessarily.
Dr. Farion, I'm glad you mentioned masks and you know, that the recommendation is there because, you know, I mentioned misinformation, and this is one of the things that we've gotten a lot of misinformation from, I believe, in particular on social media, and some people saying that the mask isn't effective at all, that it's a waste of time. Public Health, Ottawa Public Health saying otherwise, obviously.
Okay, so the mask does not help a healthy person from getting infected by being out and about in the world.
Okay.
It's more important that they are maintaining good hand hygiene, not touching their face, and those sorts of things are much more effective than any mask. The masks are meant to contain secretions in those people who are sick, and that's why we need those mask supplies to be maintained for. For healthcare workers who are coming into close contact directly with patients who are sick and who, you know, can't wear a mask all the time when they're in the hospital or when they're in the healthcare environment, then we do put different types of masks onto healthcare providers to prevent them from being coughed on or sneezed on,
right,
and putting that right directly into their face and to their mucous membrane. So that is why healthcare workers are wearing masks, but the general public do not need to wear masks when they're out and about, which should be really only for essential services, getting to the grocery store, getting to the pharmacy, and those sorts of things at this point in time.
Dr. Farion, let's talk about assessment centers. We've had a couple here in Ottawa so far. You know, people can find out, of course, going to ottawapublichealth.ca to find out where they're located. But beyond that, let's talk about who should be going to those assessment centers.
So currently the assessment center is at Brewer Park is meant to be there for people who need to be tested. That is what we are currently in, that testing phase. And so anyone who's got an acute respiratory illness, so new symptoms of fever, cough, sore throat, runny nose, that sort of thing, and they've had contact with someone who's got COVID-19 or has been a traveler, or they themselves have been a traveler, should be considered for testing. And so that is the focus of the center at this point in time. Those with very mild symptoms who don't have any real risk of COVID should really self-manage those symptoms at home. And only if they're feeling very, very unwell should they be seeking alternative care in the emergency departments or through their primary health care. The assessment centers will gradually evolve to be more about treatment, and that the notion of travel will be less of a concern, because if we have more cases in our community, then your risk of having potentially gotten it will be slightly higher, and the travel component won't be part of the definition. But for right now, it is primarily for people who have traveled or have had exposure to sick travelers or have unfortunately come in contact with some of the few people who have proven positive with COVID-19.
Sorry, go ahead. Go ahead, Dr. Farion.
New direction last evening included healthcare workers with symptoms irrespective of travel and a few other small populations that need to be considered testing, and again refer to the Ottawa Public Health website for those details.
Taking all that into consideration, can you give us an idea of, yourself and your colleagues, what kind of stress is this putting on our healthcare system, in particular locally here in Ottawa?
So I think it's putting stress in two or three ways. First, we're already at a busy time of year through the viral season where most hospitals are already working at relatively full capacity, and that activity needs to continue. Those are essential services for our community. A second stress is just all of the changing dynamic of this illness and of this condition and crisis in our community, and trying to stay up to date with all of the changing directives and recommendations. So that is a stress on the healthcare system as everyone tries to stay up to date.
Right. Dr. Farion,
sorry, go ahead.
I was just going to say, I can't thank you enough for joining us this morning. I'm just going to share some extra information to our viewers as I let you go here. But thank you very much, and hopefully we can remain in contact with you and keep the citizens of Ottawa up to date on this ongoing pandemic. Thanks so much.
No problem. Anytime.
I want to remind everyone, ottawapublichealth.ca, the place to go for up-to-date information. It's your best source. You can also call telehealth at 1-866-797-0000. We'll be back with more right after this.